Hey guys, it's Dr. Sam Robbins, and today's topic is something that I've been asked a bunch of times. It's for anyone who's considering taking testosterone replacement therapy and they're concerned about prostate growth or cancer. This is actually a question that I received in an email, and it goes, Dr. Robbins, I did a blood test recently and my testosterone levels were on the low side. My total testosterone was 320 with a range of 250 to 960. My doctor suggested I get on testosterone replacement therapy. I'm 62 years old. I obviously feel that higher testosterone levels would be a good idea, but I'm worried about prostate growth and cancer. My father died of prostate cancer, and there are prostate problems on my mother's side as well with her brother. What do you suggest, since you're the hormone specialist? As much as I want higher testosterone levels, I obviously don't want prostate problems. Yeah, this is a good question, and it's a real debate these days, and one that I actually remember having almost 20 years ago with a urologist. And this was back then when they rarely did TRT and all this stuff and rarely prescribed testosterone those days. Now, these days, many people do go to these hormone replacement clinics and get all sorts of drugs, testosterone and growth hormone and various blockers like estrogen, DHT, and so forth. And it's honestly a very big and lucrative business. Now, in your specific case, the reader, yes, it looks like you have somewhat low testosterone, even though it is in a normal range. Of course, how you feel matters. Even the testosterone level is low or high. Having low libido, low drive, muscle loss, belly fat, negative mood, and all that is also another thing to look into. Unfortunately, you didn't say what your free testosterone levels are or what, your other various female hormones are, such as estradiol and prolactin, or your DHT, dihydrotestosterone levels, or your PSA score for your prostate, or what about adrenal hormones like DHEA and cortisol? All of these hormones and a few others will easily affect your total testosterone levels, good way or a bad way, which is just one indicator of a healthy hormone level. Please don't only just test for testosterone or total testosterone. There's lots of other hormones. You see, a good doctor would have tested all these other hormones before telling you to take testosterone. But again, so in this case today, I can't just blindly give you an answer. But before I continue with the clinical studies to let you know what science shows, I want to share a personal story with you. And it was about 10 years ago, my friend's dad was given testosterone by his doctor because his levels were low. And he's 72 years old, he's in decent shape and fairly healthy. So the first couple of weeks, he felt great with the testosterone. By the end of the month, he started actually having some side effects. By the end of the second month, he started losing his head hair. He was actually starting to bald. Mind you, at age 72, he had almost a full head of hair. So I would have personally figured that he had great hair genetics and, nothing was going to cause the hair problems. Yet taking the testosterone therapy triggered something and started causing hair loss. By the third month, he noticed that he had lots of urinating problems, in the middle of the night and so on and so forth. And then when they did a blood test, his PSA score had almost doubled and hence potential prostate growth. You see, the testosterone did give him more energy and he did feel better. But honestly, at the end, he got off the testosterone because he didn't want to go bald and didn't want to have prostate problems. It just wasn't worth it for him. Now, my point with this story is that you just never know how your body will react. Now, in your case, or anyone who has a family history of prostate problems or growth or cancer or BPH and prostate cancer and so forth, it's obviously a potential warning sign and that you rightly should be concerned about. After all, prostate cancer is the leading cause of cancer death in men. Well, actually, lung cancer is, but that's 95% related to smoking, which is obviously self-inflicted. So prostate cancer is the main one. Now, looking over many clinical studies, that I did, that TRT, testosterone replacement therapy, and prostate outcomes, the studies for these two, the conclusion is that the researchers do not know, especially regarding long-term use of testosterone and prostate health. Now, if you're a person who has prostate cancer, it's obviously not recommended that you take testosterone. But it's not mainly because of testosterone being the problem and the cancer, but because if it's, what I call younger brother and sister, which I'll talk about in a minute. You see, some clinical studies actually show testosterone accelerates prostate cancer, and some studies show it can actually help advance prostate cancer in some men. So there's mixed outcomes in the clinical studies. And some studies show that testosterone therapy can cause prostate growth and higher PSA levels, and some studies show no correlation. So again, mixed outcomes. However, one thing is for sure, there are no really long-term studies that give any definitive answers to today's topic. Now, is testosterone the real cause of prostate problems? No, I don't think so, or else young men would have prostate problems since that's the peak of your testosterone levels, in your 20s. Yet older men who have much lower testosterone levels typically have prostate problems. Even though the prostate does tend to grow due to aging, there are other hormones that can contribute to prostate problems, and it's been clinically validated. Hormones such as various estrogens, DHT, dihydrotestosterone, cortisol and stress hormones, IGF and growth hormones, insulin, and others. Now, what happens when you take testosterone, whether it's an injection or creamed, exogenously? Well, it can easily convert to these problematic hormones, the estrogen and DHT, both of which are known to cause cancer and prostate problems. And this is what I said earlier when I said testosterone's younger sister and brother being the real problem, because testosterone can convert to estrogen and DHT. But allow me to paint the real picture of how things work if you want to do TRT. First of all, a doctor or HRT clinic will give you testosterone, right? Like your doctor was going to. As usual, it's typically not the correct dose. Many times they actually give you too high a dose. Now, being that someone is older, in your case 60s, or when typically men take TRT, they're older, they have more body fat and age and so forth. And what happens is testosterone converts even more to estrogen and DHT as we get older. So now you're starting to have some potential side effects because there's more estrogen and DHT, potentially, gynecomastia or man boobs in some people, and yes, prostate problems. So then the doctor or HRT clinic will then prescribe you estrogen and or DHT inhibitors, such as Arimidex and Proscar or their generic versions. So now the estrogen and DHT have come down, but then it's typically a little bit too low since these drugs are very powerful, okay? And now you're going to have libido problems since estrogen, DHT affect sex drive. Now, in addition to, there's more stress on your heart and brain since both of these hormones are neuro and cardioprotective, meaning for your brain and your heart when these two hormones are in a healthy range. So you don't want them to be low, and you obviously don't want them to be high. So what happens? Well, now you need to start playing around with all the various drugs, the testosterone, the inhibitors, and so forth. And it's got to be just right for your body and your genetics. This requires lots of office visits and blood tests. All of this means lots of money out of your pocket and unfortunately into the doctor's bank account. Let me make it very clear. I would say that at least 95 to maybe 99% of doctors and HRT clinics will never do any of these important things specific for your body and your genetics and do all of these tests all the time. It takes too much time, and of course it takes a lot of knowledge. They'll typically give you like a cookie cutter drug dosage and that's it. And maybe later on, if you can't perform sexually because the hormones aren't balanced well, guess what? They'll give you Viagra and Cialis. Again, more drugs and more drugs. Eventually, after a few months or maybe a year or two, many men just give up due to all the hassle and the shots and the pills and the cost. They're taking multiple drugs. But guess what? Now your testicles are completely shut down because of all the testosterone you were taking. So nothing works and you're actually worse off than when you first started. So how do I know all this? Because I've dealt with so many guys and so many clients over the years with these same horror stories. Hormones and drugs are very powerful, and you better know a very smart and caring doctor to help you. If you can find one, great. If you can't, I suggest you do it naturally first, okay? Improve your testosterone levels naturally before you go on TRT drug route, because once you start, it's really hard to stop. TRT can be very valuable when done correctly. But first, why not try to raise your testosterone levels and optimize your hormones naturally? You should do it anyhow. This way, even if you do take TRT later, it'll be even more effective. But doing it naturally, you won't have any of the negative side effects. It'll be good for prostate health, and in addition to your libido and sexual performance. Doing it naturally is something you can do for the rest of your life, and it'll improve your health, fitness, and longevity. First, fix what's causing the problem, in this case, low testosterone. And I've given proven options below this video in the description area. Just scroll down. There's lots and lots of free information on how you can do it naturally. Be consistent and be patient because it will take time. But for many guys, it happens, within the first month or less. But if you still have issues after, doing it naturally and testosterone is still low, then go find a really smart and caring doctor to help you with the TRT specific for your body and genetics. Pressure the doctor to do all those proper blood tests so you have the correct information before you make any decision about your health.